Welcome back, everyone. With me to talk about Mark Cuban Cost Plus Drug Company is the CEO of Hartig Drug, Charlie Hartig. Welcome, Charlie.
Hey, Brad. Thanks for having me.
Yeah, it's glad to have you here at Climb again. So let me give a little background. Charlie is the fourth generation CEO of Hartig Drug. His grandfather or great-grandfather started Hartig Drug in 1904 in Iowa. They have 23 sites today in 3 states, Iowa, Wisconsin, and Illinois. And so you've been around, your family's been involved in this for a very long time. Charlie and I have been talking about Mark Cuban's company and what the impact would have, and that's what we want to focus on today. As our viewers and listeners know, there are a lot of problems in the pharmacy world, and it's an expensive, prescriptions are expensive. I think most Americans know that as Americans, we pay more for the same drug than anybody in any country in the world. There are a lot of reasons for that. As industry insiders, we could open the can of worms of all the things that are wrong that cause that. And there's a lot of misinformation out there. We are not here to open that can of worms today. We're here to really talk about what Mark Cuban is trying to do, what that impact is going to be. Is it going to be disruptive to independent pharmacy in particular? And so let's just get started there. There's a lot of hype on this. I've read a lot of articles. There's many in the media that think that this is going to be really disruptive. There are plenty of others that say, no, it's really not going to be disruptive. And so what I want us to focus on, Charlie, is what your thoughts are and how you're going to be handling that at Hartig Drug. So let's talk. Is it going to be disruptive? What are your thoughts?
Yeah, I think the first thing we probably need to do is give credit to the Mark Cuban company, his company, and to say, this is an area where, he sees a potential need, given kind of the information that he and his team have. And quite frankly, there's probably some viability in this business model. There's certainly a lot of gaps and problems, which I think we'll talk about, but the idea of pulling out insurance and PBM in the pharmacy space is definitely a noble cause. I mean, that's where a lot of the challenges in our profession stem from, right? Back in the good old days, as my dad would have said, when we were typing up prescriptions on a typewriter and charging cash for most prescriptions, prices were fairly in line with general costs of goods. That's obviously healthcare costs have skyrocketed over the last several decades. And part of that reason is the middlemen of PBMs and insurance carriers and other sorts of, insurance vehicles, I guess I'll say. High deductible plans is a great example. So I think the idea of offering a cash, simple mail order solution is not a bad one. That said, I don't think it's very new. PillPack and Amazon are in that market. Discount cards and other mail order groups have been in that kind of market as well. Even GoodRx, you could argue GoodRx to some degree is kind of trying to drive an affordable cash, quote unquote cash amount or payment from patients. So there's definitely probably the need for it. But I would tell you that I don't think necessarily these types of organizations and new business strategies are really anything all that new. It doesn't make it any less dangerous or competitive for independent pharmacies, but it's something that I think independent pharmacies have been dealing with and combating, and probably fairly successfully so over the last several years. Hartig Drug has strategies in place to kind of work through these cash or cash plans like the Mark Cuban plan or the Amazon plan or when we really started, it was the $4 Walmart list. I mean, that's really the same type of problem. So when you see what Hartig has done in the past and you see other independents, I mean, a lot of times we'll price match or create our own $4 list for medications that we can meet and match. And we still do that today. We still have 30 counts of omeprazole for us for that, and it's at $4. And we compete with groups like Walmart and Hy-Vee on a daily basis on that plan. And so to some degree, the Mark Cuban cost plus drug model is really not that much different.
Well, and it's interesting because I think depending on which article you read or which headline you read, it varies in the details. And the thing that we want to make sure everybody understands is really this is just for cash prescriptions, right? And it's 100 different drugs.
It's and Brett, it's even more niche than that. It's cash for only like 70 to 100 different NDCs, and these are being touted as the ones that are exorbitantly high priced. That was how the model was originally delivered, right, or at least to my understanding, right? So he's picking generic Gleevec and other drugs like albendazole that are really the prices have been jacked up in general historically because maybe there's only one manufacturer in the market.
Gotcha.
And it's important to note that Mark Cuban right now is not a drug Mark Cuban cost plus drug does not have a drug manufacturer. In fact, they're not making any drugs right now. They're sourcing them all from the same places that independents source them, same places that we can buy drugs today. So go ahead.
Yeah, there was an article in the Washington Post, and the author of this article talked about generic Gleevec and said, his company is offering it for $17.10 a month, and it says that the list price is north of $2,500. So this is just a huge savings, but that $2,500 list price isn't a real price. Can you?
Yeah, I mean, I hope the guy from the Washington Post isn't listening, but that's kind of sloppy journalism, I guess, is what I would say. When you look at these list prices, you're talking about the UNC price. Every independent pharmacist that's going to listen to this, or it's going to watch the recording at a later time, knows that UNC price is not an accurate price of what things cost or an accurate price of what usually pharmacies are reimbursed. It's not like pharmacies are making $25,000 for generic Gleevec. If we were, I'm in the wrong business. I'm focusing on the wrong stuff. So these retail prices that you see on Mark Cuban pharmacy, cost plus pharmacy, are inflated for a purpose. It's a marketing purpose, right? It's trying to show and dictate value where that value may really not be there. Even when you look at the costs of the drugs that the company is holding out, I mean, they are good costs. They're fairly low costs. That said, 85+% of the U.S. population is insured, and most of those costs are still higher than the average person's copay or cost insurance obligation. So you're not talking about tapping into 330 million Americans. You're talking about tapping into uninsured and underinsured Americans. That's not really, where most people, it's just a good thing to remember. You're not talking about a marketplace of everybody. You're talking about a marketplace of a pretty substantial small size in comparison to the entire country.
Right. And in fact, I think when we were talking before, you mentioned a couple of drugs that, represent, that are on that list that, out of your 23 pharmacies and hundreds of thousands of patients, you dispense, 100 times a year.
Yeah, some of them are very rare.
Yeah.
And that's kind of one of the reasons why the prices have kind of bumped up and been inflated, because you may only have one maker and one manufacturer in the market. And, that's an essential monopoly, right? I mean, that person can charge pretty much whatever they want. Martin Scarelli went to jail for that. He had the single source for one generic, and it was raised 5,000%. So the answer is yes, there's the idea of, I think the original idea, as I recall, in Mark Cuban's cost plus pharmacy, and I'm just going to start calling it cost plus pharmacy because Mark Cuban's cost plus pharmacy is a mouthful.
Yeah,
so
right.
The main premise in cost plus pharmacy was essentially, let's go find these really high cost generics. Let's bring down the list price and let's sell them to some people for an affordable price. And I think that's a very noble cause. I think that's a great thing to do. And I think a lot of pharmacies, independent primarily, have been doing that for years with not a lot of fanfare. Ever since the anti-gag clause that the Trump administration passed, a lot of pharmacies are, they're looking at a patient staring down the barrel of a $200 copay. They're saying, I bought this drug for $80. Well, why don't I just charge him $100 cash and save the guy $100? And I make 20, And you know what? The insurance company gets zero, and we all have a good day. I mean, I think that that's been happening probably more frequently than most would suspect. Also, I think that you see a lot of other players in the market who are already there. Amazon has a $6 list. GoodRx, using PBM networks, has managed to bring down these prices over the counter, much to the detriment of pharmacy, because you would pay high admin fees on GoodRx. Hartig Drug does not accept the GoodRx card at this point in time because we just can't afford the admin fees. But there are a lot of ways to combat, there's a number of different strategies that you can use to combat these kind of $4 generics, the cost plus pharmacy pricing. You can use price matching. You can find and develop a discount card program yourself, much like CVS and Walgreens and Kroger and a number of the chains have. Hartig Drug has its own discount card program, which we use to kind of combat a lot of these processes as well.
For a single or two-store independent, is that a doable thing?
Yeah, it's totally doable.
And can you just briefly describe how one would go about this?
Sure. There's a few discount card groups in the market, and I'd be happy to, if anyone's listening and they want more information, I'm happy to give it to them. I hate to give a promotion for one card over another, sure. But there are groups that will basically say, we're going to offer a discount card. The rates are going to be set at X, and those rates can be negotiated at arm's length with the discount card carrier. And it essentially creates a negotiated rate and a reimbursement that the pharmacy can cover their costs, and including drug costs and overhead on an aggregate level. And it gives some consistency to what would be considered a kind of a cash price or a discount card price. In some sense, buyer beware, right? Because you're still going to be having admin fees, and you're still going to have some, formulary restrictions. And also you're going to have some elements where branded products are just, quite frankly, too expensive. But by and large, in the generic market, a discount card solution for independent is a manageable process. I think you just need to be very cautious about which type of discount cards you pick, and determine who's your friend and who's not your friend, and that
sure.
That's probably easier said than done, but it's definitely doable.
Okay. So when we're talking about this, I asked, is this going to be disruptive? We kind of addressed that. At Hartig Drug, what are you telling your pharmacists how to handle this, how to handle a patient that brings this up? And are is there anything proactive that you can do?
Sure. The first thing, I think there's a couple of roadblocks, I think, to say that this is going to be an extremely disruptive model. The first is just the number of drugs, right? So you're only going to have 100 SKUs of medication or 100 NDCs. And, most people who are on medications over, 55 or 60, I think the data suggests that they're on 4+. The likelihood that all 4 of those are going to be the 100 that cost plus pharmacy carries is very, very low. The same happens at the $4 list for the Walmarts and the Walgreens of the world, and the same happens in Amazon land. Just the reality is they're not offering all these drugs at these low prices. They're just advertising the ones that are low priced. So it's really important. The first thing to do is to make sure that a patient has done their diligence, or the pharmacist has done the diligence for them, and say, this is a little bit of a bait and switch, or this is a little bit of a loss. They're taking some loss leaders on some of these products, and then the other ones are going to jack you up. And the price isn't going to be exactly as affordable. The other thing to remind patients is, if you have insurance, you should be looking at your insurance plan, understanding what your cost sharing obligations are, whether it's co-insurance, which is a percentage, or a co-payment, which is a flat fee. And in many cases, the co-payment is going to be less. Specifically, in most Medicare and Medicaid plans, the payments will be less. So that's a large number of the population who, won't benefit from a cost plus pharmacy type model. And also, they're not accepting Medicare and Medicaid in these models. So right. You could go there if you wanted to. The next thing I always had mentioned to my pharmacist, and when I mentioned to a patient, is you're not going to get any of your controlled drugs. You're not going to get any diabetic test strips. You're not going to be able to get any insulin or anything that's temperature sensitive. Eye drops, ear drops, all these things. And so, yes, you could cherry pick one or two medications to go to a cost plus pharmacy like Mark Cuban's cost plus pharmacy or Amazon or another, but you're going to be managing multiple points of care yourself, and many patients just get too confused when they're on too many, if they're on multiple medications. And also that fragmented care can cause some clinical issues. I was in the pharmacy earlier this morning. I caught a mistake written by a doctor. If one of those would have gone to cost plus pharmacy and one goes to my pharmacy, that interaction might not have been caught. So there's some legitimate clinical concerns about fragmenting care as well. And I understand people need to watch their pocketbooks, especially in kind of the world we live in with inflation and the economy where it's at today. But at the end of the day, there is some legitimate value for keeping your prescription medications in one spot. And any pharmacist, chain, PBM, retail, hospital is going to tell you that too.
And I think that brings me to that, what can independent pharmacists do to educate their patients, and can we be proactive as an industry in educating on this type of thing?
Yeah, so I think the first thing pharmacists should be doing, is addressing, requests to transfer directly and accurately. So if someone says, well, I've seen this cost plus pharmacy, can you transfer my prescription there? Or can you get my doctor to send me a new prescription there? That is, a great education opportunity to say, are you really sure? How much are you sure it's going to cost? Are you going to get it timely? There's been several times where maybe you forgot to refill your medicine and I can fill it in a day or two, or within the afternoon or sometimes 15 minutes after you call me. It's going to take quite a bit more time to get something processed and shipped from Houston, Texas to wherever you live, right? You also lose face-to-face interaction. The statistics on how many people actually talk to a pharmacist from a mail order pharmacy are abysmally low, like point something percent. And you're seeing a pharmacist every time you walk in when you receive your prescriptions. And not every person really appreciates that interaction every time. But when someone's late on filling a medicine or early, that's a great opportunity for us to ask them questions about clinical concerns. Today, I had somebody come in for an inhaler early. We were able to fill it, but I asked them, are you taking your underlying maintenance medications, your Advair, generic Advair inhaler, which is supposed to help you not use the rescue inhaler so much, right? So those types of interactions do not happen. And those types of interactions can actually keep people out of hospitals or people from asthma attacks specifically in that instance. So you lose that, and there's a ton of value there. Quite frankly, value that pharmacists have never been paid for or compensated for, which probably should be. But that's a story for a different day.
Right. For sure.
I think the other component is, you have to consider that this is already in the market. And so when someone says, I want to go to a cost plus pharmacy and get my medications mailed, I think you'd say, well, why is that any different than coming here for a discount card that we have, or maybe a price match? Sometimes independent pharmacies are great about price matching opportunities as long as they're above cost, and there's a little bit of margin there to keep the lights on. And I think that, that's another option when you're talking to a patient about this. We've also had some good success in talking to physicians and explain to them the value that we provide, outside of just filling and licking and sticking and pouring. So, with independents, guerrilla marketing is much more effective. If Mark Cuban's face or if GoodRx are blasting their ads on Hulu, that's a kind of a broad brushstroke campaign tactic. We can visit with our physician partners when we're at church on Sunday, right? And talk to them and say, hey, Dr. So-and-so, we're seeing some people leave for these medicines, and, we're a little concerned that their adherence is going down. Will you make sure to check and by and large, the physicians find that, maybe people aren't as adherent when they're using a mail pharmacy or not. But that's very much another step that independent pharmacists can take in combating this. One of the tricky things, I think, is that really you don't understand the bleed to when people go to a mail order pharmacy, because many times we don't transfer the prescription to a mail order pharmacy. Some mail order pharmacies actually have a practice where they will contact the doctor for new prescriptions. So you'll never even know some of your patients leave until you haven't seen them in 2 or 3 weeks or, a month. And so that's something we haven't really figured out yet. The big question is, how many people are not walking in your door because they saw a GoodRx ad and then they ask the doctor to send a prescription they go online and check GoodRx and then they tell the doctor to send it to Walgreens. I don't have a good number for that, and I'm not
Sure.
really sure anyone has figured that out in terms of I'll call it the bleed or the shrink from patients from those large marketing campaigns.
Well, I think, your comment or your thoughts on independence, getting with the doctors that are writing the most of those prescriptions for their area, and that really, I'm sure, is true in rural areas. That's a great strategy, because being able to have that interpersonal interaction, if they get that call, they can talk to the patient before they transfer the prescription and make sure that they really want to do this, that they're considering all things. So educating the doctors, I think that's a great idea. And then I have to think that educating the patients, and I agree, this one's a harder one. Do you have signage that says ask us about cost plus pharmacy, or ask us, about, I don't know.
We don't yet. I mean, and I can say before this call, I did look at all of our transfers in our pharmacies, and we've not yet transferred a prescription to the Mark Cuban cost plus pharmacy. We've transferred less than my 2 hands of Amazon. And so I know those threats are out there. I'm pretty comfortable saying that once people use our pharmacy, they're very rarely switching except for insurance issues. Obviously first of the year is still fresh in my mind and we're still going through it, but you have a lot of people who move medication profiles from pharmacy A to pharmacy B because the insurance company, Express Scripts, Caremark, Optum, whichever you pick, take your pick. It's usually one of those 3. Have narrowed their network and said you're no longer in network. Usually without us even knowing it. That's really common. And but that's a little bit of a red herring. That's not a cost plus problem.
Right.
It's not a GoodRx problem.
Right. Yeah. And the even if somebody who's on insurance were to decide that they think they might want to do that, they got to remember that those people have to remember that this, if anything they buy from cost plus, is not going to go towards their out of out of pocket costs. So
these aren't easy conversations to have, right? I mean, pharmacists aren't usually huge self promoters. We're a pretty quiet bunch when it comes right down to it. And it's much easier to frame the conversation about care and fragmented care. And it's also much easier to frame the conversation about access and having access to your pharmacist, and having a pharmacist who actually is knowledgeable about your disease states and what you're taking. If I know Joe Smith has been on atorvastatin for 10 years and I get a prescription for something different, well, that's definitely a call to the doctor to make sure it wasn't a mistake. And by and large, and it may be a mistake, or it may be a change, and it may be a good change, and we need to talk about why that is changed for him. Diabetic patients are incredibly complex, and if you're getting 1 or 2 medicines in the mail and you're getting the rest somewhere else, I mean, it can really change the game. So I think it's really important that we frame initial conversations about using mail order cash pharmacies in that frame, that clinical concerns, because they are legitimate, and then following it up with education about, well, hey, this really isn't that expensive. I've seen people switch for pennies difference, and I couldn't convince them otherwise, but at least I made the conversation happen and I took the effort.
Sure.
That's I think all you can do.
Well, and I think, I think this is just generally true in business. Creating the relationship is important. Pharmacists continue to be in the top 3 and usually the number 1 most trusted profession in the country. Utilize that. Utilize the fact that you're highly respected and trusted, and continue to engage with patients. It is so much more than filling, moving tablets from one bottle to another bottle and slapping on a label, right? It's so much more than that. And I think pharmacists absolutely have to, whether they like it or not, they have to engage. And even if you're not getting paid for it, kind of the pay is that you get to keep the customer. In certain degree.
There's still a level of the communicate, and also just, it might not even be face to face. I think there's a lot of pharmacies, there's most community pharmacies and independent pharmacies, people who come in value the face to face interaction, but even more so than that, it's the little things. It's the communication. It's the, hey, I have to, can you deliver this? And it's, yeah, we can deliver it. Well, I'm out today and I need one by 6 p.m. Can someone drive it over, before? Maybe you have a technician who lives 2 blocks away and she's leaving at 4:30. She's like, well, I'll drop it off, right? Those little tiny, those little tiny changes in convenience and service-oriented tactics sound so, so nominal. But when, it's all coming via UPS or FedEx or USPS, and it gets there when it gets there, and a hub shuts down for 2 days because everyone's got Omicron, COVID, or FedEx distribution centers backed up. There's a lot of processes in that chain that can go wrong. Certainly things go wrong in independent pharmacy as well. But, there's a lot more ability to adapt at the level of you're in town, you're on the ground, you're going to take care of the patient, and you can fix things within the day in most cases, or by next day when you can get your prescription in the order.
Sure. Okay, well, I think we're kind of out of time. Do you have last word? Anything else you didn't cover that you would like to comment on?
Yeah, just to kind of put a bow on it. I think that Cost Plus Pharmacy is, it started as a really interesting and exciting opportunity. I would like to just point out that there have been folks that have been doing this before Mark Cuban's gotten the game. Besides the $4 lists that have come out from all the big boxes, you got folks, I've seen articles on social media about, folks like Blueberry Pharmacy out in Pennsylvania, and he's done a really interesting and, really exciting opportunity just to basically take an independent pharmacy to say, we're not going to accept insurance, and we're going to do the same thing. And by and large, it appears successful. I've never met, I believe his name is Kyle. I've never met him, but it seems like he's creating a thriving business. And I think that you might see more independent pharmacies moving to a cash only or a membership only model, especially if insurance continues to compress margins in the independent pharmacy space, which does not appear to see much relief. Albeit we'll see a lot of changes at the state level with the Rutledge decision in the Supreme Court, and a lot of states like West Virginia just passed a really great PBM bill, and hopefully that continues. We're trying to do the same thing here in Iowa.
Great. Well, Charlie, I really appreciate your thoughts, your time. It's been great, and I hope that you viewers and listeners get something out of this. Don't panic, but don't pretend it doesn't exist.
Yeah,
I think
agreed. I think sticking your head in the sand on this one would probably be short-sighted. I think you still want to have a strategy and start thinking about talking with your staff and saying, how are we going to tackle, kind of the good RXs, the Mark Cuban Cost Plus pharmacies, the Amazons. It would behoove you to at least have a plan. We have a plan. I wouldn't say we execute it perfectly every time, but we have a plan, and we try to do what we can do to keep patients happy, to save patients money, and to make sure that they get the care that they need, care they deserve, really.
Right.
Right.
Okay. Well, thanks again, Charlie. Have a terrific day, and hope to have you back soon.
Yeah. Thanks, Brad.
Bye-bye, everyone.